Welcome to another day of the life of TLE. I am back and I'm going to be talking about a few things. I think I'll start with medical insurance. So, when I found out that I had cancer, I had 6 weeks of treatment, 6 months of treatment before I felt like, um, well, I was overwhelmed before 6 months had passed, but I was hanging on to my job for a variety of reasons. One, because I needed the insurance, and because I needed the money as well. And so when I found out over the summer that cancer had reoccurred, I talked to the doctors, and they both suggested that I take a leave for ICE chemo, which was the next chemo. My first chemo was ABVD, and so when I decided to go and do the second treatment, I did decide to take a leave from my job. Therefore, everything changed, and my job was offering to pay for 3 months of premiums, and then after that, I would have to go on Cobra, which is $845 a month. Um, and so, medical insurance was really, really big in the midst of an illness, and a couple of times I had given up on trying to keep the premiums paid or um, active, I should say, because um, one reason in particular was because the hospital had originally said that they had a program that would help pay for premiums, and then they kind of said that they didn't know what I was talking about when I mentioned it. And so after doing some digging and prying, they said that they did know about it, and so they had me apply for it, and then I applied for it, and then in the process, I was trying to do other things like get an income and things of that nature while I was on leave. And so, from what I understand, in order to get things like Social Security or disability or whatever the case may be, you need to apply for Medicaid. I think it's Medicaid or Medicare. I don't know which one it is, but sorry. So I did all this stuff partially out of it because when I was doing all the paperwork for disability, I was still in the hospital. I had had surgery, so I was a little out of it, in and out from the medication. And long story short, the hospital approved me for the fund, and then said that they were taking it back because it was only supposed to be until I had a supplemental insurance. I think that's the way they explained it, which is not what they said in the beginning, because I was trying to keep the insurance that I had because I didn't want to change doctors and things of that nature. So it was really a shock to me to find out that they were not going to honor the grant or whatever it is that they were originally offering me. And so I had just kind of coughed it up and chucked it up, or whatever the case may be, and just was like, well, I can't afford this. I don't have the money to keep the premiums going, and they're not going to give me the grant, so I'm just going to be without insurance. And I remember feeling like I had lost a loved one or a limb, because it was so and it still is really important, but at that time it was a really crucial time because I hadn't scheduled a transplant, and we had been talking about it at the end of last year. And then I was just thinking, like, what the heck does this mean as it relates to going forward? And my transplant, would this affect anything? I don't know what services would be offered under Medicaid or Medicare. I know that I will lose the other benefits that I have if I go on that. And so, yeah, I just remember feeling really, really bad and really, really hurt and discouraged and other things. So, miraculously, we found a website for the lymphoma, and I think it's the LLS Society, and they paid the last 3 months of a portion of the last 3 months of the insurance, which really helped out. And so now I'm on the brink of going into the next couple of months and trying to get those paid. And I'm taking it, month by month, because I don't have it all figured out, and I'm not going to stress myself as I have in the past about things that I have no control over. I'm just going to stay hopeful, and hopefully I get through this. So that's my insurance spiel. The next thing I want to talk about is side effects from the chemo. I mentioned that I had a couple of chemos, but the first chemo that I had was ABVD, and with that chemo, I was really, really nauseous. I remember being really nauseous, and every medication that they gave me for nausea made me nauseous. And so, on top of the actual drug making me nauseous, or whatever drugs they were giving me, the drugs to maintain the side effects were making me nauseous. So I was just one sick puppy. There's a lot of mucus forming, and everything bothered me. Every scent, things that I've been using for years, like lotions and soaps and deodorants and things that my skin and my that work with me, my chemistry, I could no longer use. And so then I had to try to find all these unscented products, and some of the unscented products were scented. I could smell them and they would make me sick. So it was just a disaster. It got to a point where I didn't feel comfortable going out because I would have to, I would feel like I was about to throw up a lot, and I would have to go to the bathroom doing a lot of spitting and things of that nature. And so it was just really, really bad. So I ultimately decided to stop taking a lot of the nausea medications, and that helped out quite a bit, but I still had quite a few symptoms of nausea, among other things. There were, of course, the hair loss. My skin had turned really, really black, and my tongue was black. The bottom of my feet were black. My hands were black. My wrists were black. My ankles were black, and even part of the top of my feet were black. My nails, of course, they had told me that they would turn back black, so I expected that. But some of the things I didn't know was going to happen, and so that was major. Losing my hair, or my hair thinning, that was major. Some of the cognitive problems that I was having with processing and thinking and talking, and that was also pretty prevalent at one point. And my moods would change a bit, and I'm not sure at what point in the chemos. I think more so towards the end, and that could be related to the steroids that I was taking, in addition to the treatment that I was having. So that was something that I've noticed as well. My ability to handle things had changed, and so my tolerance level was definitely altered, and my patience was as well. I wasn't as, I just couldn't handle some things that I had previously been able to handle. And so that's that. And so the other thing that I want to talk about is um, my 100 pounds of chemo, is what I call it. And that's just making reference to gaining 100 pounds over the last year of treatment. I am now very close to 100 pounds heavier than what I was when I started off. And so that comes with some complications as well, getting tired faster, feeling like I'm carrying an extra person, shortness of breath, and kind of in addition to having some lung complications already. And not being able to fit anything is the most nagging problem with gaining 100 pounds, I guess. It's not healthy, of course, and but yeah, wardrobe is just like really tripped out these days, and yeah, so I'm dealing with that as well, and I'm still taking steroids, and so there is. So far, I don't have a clue as to when I would be completely tapered off of them. So I am concerned about gaining more weight for both financial and physical reasons. And so yeah, that's that. And another side effect was just like my stomach, going back a little bit, my stomach would flip-flop with both chemos, always unsettled. And while I did have an appetite with the second chemo, the first chemo I didn't have as much of an appetite until I started having these urges to eat, and I would just wake up and I'll be thinking about food, and I would eat it, and then like an hour or two later I'll be thinking about food again. And I couldn't figure it out in the beginning, because before I would have to kind of make myself eat because of the schedule and how the day went, and then I went from like thinking about food and planning on eating, so I knew something was wrong. And so I later found out that the steroids that I was taking during all of the chemos actually may cause an increase to an appetite. So yeah, my stomach, in addition to having all this flip-flop behavior, I was also wanting to eat, and in the midst of trying to eat, couldn't eat 90% of the things that I wanted to eat, because one, I had lost my sense of taste, and I couldn't taste most foods. And so in the beginning, the only thing I could taste was eggs, tomato paste, things with tomato paste products in it, and cheese. And so my diet consists of a lot of eggs. I sometimes had eggs for breakfast, lunch, and dinner, or sometimes pizza, which I've never been a big pizza person, but it worked. Now I'm not able to eat it like I was eating it last year, but it bothers me. I think it's the prednisone and the reflux, but yeah, it was weird because I had never been one to go to the store and just purchase pizza all the time, but for months I had to eat it. And the other thing that I was eating was cheese, and I remember talking to the doctor a couple of times about it, who later had a nutritionist come in and talk about the foods that popped, and most of the people that had been through treatment had similar experiences with the foods that they were able to taste and or had popped for them. And so she kind of gave me some ideas, like adding lemon to dishes or maple syrup to dishes to help get a taste. And so, yeah, I'm going to end this because I don't want to make my videos really long because they take really long to upload. So, yeah, I'll be back. Thank you. Bye.